congratulate everyone who won an award tonight. I'm going to hand this basket to someone in the front row. Please take a clip and pass them around until they're all gone. The difference between regular and chronic pain is that chronic pain lasts for more than 6 months. Chronic pain changes brain chemistry and how pain messages are interpreted. It is the brain that determines what is painful and what is not. When pain continues past the normal healing time, the nerves become more sensitive and send more pain signals to the brain. So chronic pain is really just all in your head. Well, in your brain anyways. Chronic pain really is an invisible disability. A doctor can't take an x-ray or a test to see where your pain is or how it can be treated. How would you rate your pain right now on a scale of 1 to 10? Most of you should say under 5. I find the 1 to 10 scale unreasonable because everybody tolerates pain differently. The reason why I say that most people's pain is under 5 is because 8, 9, and 10 on the pain scale is basically the danger zone. If you're experiencing that much pain, then you should probably go see a doctor. Any doctors in the house tonight? By now, the basket should be empty. Please attach it to your ear like this. Please do not touch, fiddle, or remove it, and I'll get back to it at the end. Even though I don't personally have chronic pain, one of the most important people in my life does. My dad got into a motorcycle accident and was left with chronic pain and a spinal cord injury. My dad can have 2 very different pain days. One day, he can be fine and we can go skiing, boating, or even do something as simple as just going into town. But the next day, he can be hypersensitive and struggle to get out of bed. In my house, we have a saying, ouchie means grouchy. Might seem silly and self-explanatory, but when someone is hurting physically, they're putting all their energy towards dealing with their pain that they forget how the words affect people. If they snap or say something rude to someone, they may not realize that they did anything wrong. Now, the person that was snapped at is affected by chronic pain. So chronic pain affects more than just the person suffering. I have 3 hopes for healthcare in addressing the chronic pain situation in BC. Firstly, my hope for healthcare is that universities and health authorities offer more courses in chronic pain. I believe all healthcare workers, present and future, need to take a course in chronic pain because if they know even just a little bit about chronic pain, they may be able to help patients consider other methods of pain control besides just painkillers. Painkillers are often the first step to addiction and overdoses. Based on my dad's healthcare experiences, he found that the first thing that was offered to him to manage his pain and pain medication. Chronic pain doesn't respond to pain meds the same way that regular pain does. He found that it was easy to get narcotics when all he really wanted was a more balanced pain management plan. My second hope for healthcare is more pain clinics. There are not enough pain clinics around BC, especially in the north. I recommend a traveling pain bus. A pain bus is a bus that goes around BC to help people with chronic pain. It would be sponsored by the government and companies who agree that chronic pain is a serious issue. The pain bus would also have a website, which would allow doctors to make appointment requests for the patient when the bus comes to the patient's community. The website would also have information for patients and the public about chronic pain and options for getting help. If someone sees the pain bus in the parking lot, they can simply walk over, get information on chronic pain, and get directed to the website. When patients attend their appointments on the pain bus, they could get referred to a specialist. If they need help with movement, then they could get referred to a physiotherapist. If the patient needs help with food and nutrition, then they could get referred to a dietitian. for a change in prescription or referral to a pharmacist. This forum's theme is Imagine Tomorrow, Act Today. So my greatest hope for healthcare, which we can all act on today, is chronic pain awareness. I would like everyone to be aware of chronic pain and how it affects so many people. If everyone in this room tells 2 people, it might not seem like a lot, but it can help so many people. For example, there are about 400 people in this room. If each of you tell 2 people, and then they tell 2 more people, 2,400 people are notified about chronic pain. And out of those, 480 people are likely to already be living with chronic pain. Now get them to tell 2 more people, and we would have told 5,600 people and helped 1,120 people living with chronic pain. People with chronic pain need to know that they are not alone. Someone is listening, and there is help. Now, back to the clips. Hurts, doesn't it? How'd you rate your pain now? Any change from earlier? Could you do that for an hour? A day or a week? A month? How about a year? How about a lifetime? Thank you.